Welcome to the Art of Healthcare show, where we have conversations with experts all about how to get better at helping the person with the problem. Today, I'm really excited to be joined by my mate, Heather Watson, who's a physiotherapist, a manager, a yoga teacher, and a learning enthusiast about all things health, healthcare, and life in general. So Heather, welcome to the show.
Thanks, Chris. It's great to see you.
Yeah, it's good to see you as well, because it's been a little while since we caught up.
Yes.
The first question that I want to ask you is, why are you interested in the art side of healthcare? Like, what fascinates you about that?
Yeah, I think that comes from my general curiosity about just human nature and like how our minds and bodies work. I really do think that we treat healthcare like a science, but it really is both a science and an art form. And um, having 13 years in the field now, I'm really learning so much more about the art of working with humans and really interacting and being creative. And I think really so much of my practice is expanding on a creative sense rather than a true scientific sense.
Cool. Yeah, and I completely agree with that. And I think I'm about as far along as you are in your healthcare journey, and I find that as well, as that it's both that art and the science that combined really drives great outcomes for people. It's having that scientific study, but it's also how do we work with people, because every person is different as well. Which also like allows you to explore your creativity a wee bit more as well, which means that you're a little bit more fulfilled in your work. And I think at times through my career, I've lost sight of that, and lost sight of that creativity a wee bit. And that's usually when I've struggled the most as a clinician.
Yeah, I agree. Like, I think the way we're taught, I don't know, like I know the way we were taught in Canada, at least to be physios, was so like it was so cookie cutter. Like we were really learning, we were learning from the beginning, and I guess it had to be, but there was this idea that like A plus B will equal C as a solution. And I think so often we go into like our careers that way, expecting that that's the magic solution. And I think where a lot of new healthcare providers struggle is when A plus B doesn't equal C. And like it's supposed to, we're told it's supposed to, but it's really when we have to like actually step back and look at it as like a creative problem solving and be really curious and be really open and like trying to figure out the problem, and that one injury can be solved 100 different ways depending on the client and depending on so many other factors. And I think the more I've embraced that throughout my career, the more fun it's become, because when you do get wins, especially with those clients that come in and say like, you're the 10th person I've seen, like, can you fix this? You do get wins, but you also, I feel like the more creative you are and curious you are, actually the more you learn, and the more, I guess, fun work becomes.
Yeah, and the more you can almost get into a little bit of a flow state with it as well, is that it doesn't feel, it feels like it just goes quickly, and it's enjoyable, and it happens fast. It's not something that you're just trying to push uphill all the time.
Yep. Yeah, exactly. I mean, and it's interesting, even within you and I have both worked within in our approach that is like a prescription based approach, like the McKenzie approach is it's very prescription based, right? Like it is A plus B equals C. But even within that approach, like, how many different ways have you solved, a disc problem or a pattern, that kind of thing? Like, it's not necessarily, maybe some of the philosophies are similar, but every patient who walks through your door, that may look a little bit different.
Yeah, and I think that's a really cool point about science meeting art, is that, okay, here's what we know from a scientific perspective, and we can use that as a baseline for our thinking and for our approach, but then the art is putting those other building blocks on top of it and making it unique and contextual to that person as well.
And that's where I really think, like, it's really starting to understand our own like boundaries and like biases and things that we might be afraid of as well. Whether it's, I remember at the beginning of my career, I was so afraid to like pretend, like to say I didn't know the answer, or I was so afraid that anybody who like came into my office, if I didn't have the answer, if I couldn't solve their problem, like I would feel like such a failure. And I think like the more I was starting to like get to know myself through yoga, and a lot of like more personal work I did on myself, the more I started to be able to understand some of those fears, and actually was able to then step into my physio practice in a very different way, because I could see where I was maybe not being creative or not really focusing on my client because I was so afraid of like failing or saying I didn't know the answer. And even saying I don't know the answer, but I'm willing to take this journey with you, and here's what I think we can try. It may not work, it might work, that vulnerability to even start to say that as a clinician is often something we're not taught. And but is, I think, the real difference between being a cookie cutter solution person and really being a patient focused practitioner.
Yeah, I 100% agree, and I think about it a little bit as the mechanic versus the artist, and that's no offense to any mechanics that I don't know why you'd be listening to this, but mechanics can be artists as well. But we don't want to just be the mechanic, because as you said, it can be a little bit of a cookie cutter approach, and it works for some people, but it doesn't work for everybody. And like I really like how you talk about that, having to do that on personal work and understand your biases and how you potentially approach problems, and then being vulnerable enough to share some of that, and to say, actually, hey, I don't know the answer here. I'm not 100% sure of this, but it's a journey we can walk together. And like, I'm really interested to hear your take on vulnerability as health professionals. So, I mean, what does it mean to be vulnerable as a health professional?
Yeah, I think, I think it's a couple of things. I think the first thing that really comes to mind is understanding or being open enough to understand both yourself and your, any of your biases, or maybe some of your like negative core beliefs or things that you carry with you into an interaction with a client, that might limit you in how you react or how you act with a client. I think this is really important, because I think so often we are under such time pressure to make clinical decisions and to assess and treat, that I think often we forget how quickly some of these things can come out in our practice. So I think that's twofold. I think it's understanding our own selves better and knowing how we're showing up in the room is the first part. And the second part I really think that goes hand in hand in that is, once you start understanding yourself and maybe how your reactions can affect an interaction, it also then allows you to be more compassionate and open and vulnerable to sit with your client in some of their own fears or their own biases or maybe their own like beliefs. And instead of just being like seeing that as a barrier, seeing that as an opportunity. to connect with your client. I guess I have an example. I have had one client. I remember I remember this moment really vividly. I had this one client who was very pain focused, very anxious. We were working very, very, very slowly together, and I had built some of her trust. But like, I'll admit, I was finding it was a frustrating interaction, and you know, I was bringing some of my own frustration to the table, like quietly, as we do as, you know, as practitioners. And then I went away for 2 weeks and was finishing up my yoga teacher training. And during that time, we had done a lot of, you know, investigation work on our negative core beliefs and how those came up in our lives. And I think it was like the next, like, it was the first day I was back in the clinic, and she was on my schedule. And I just remember for the first time, just sort of, instead of being like in a hurry for her to stop talking, or like, you know, so I could actually give her some therapy, like I kind of just sat back and listened to her and actually saw her, I really for the first time saw her fears and her own vulnerability, and like how that was presenting within her pain. And from that point on, I was able to kind of like remove myself from the situation and actually connect with her, and you know, address some of those fears, and rather than just trying to fix her pain.
Cool. Was that when you were working with me as well? Because
Yeah.
I remember you going away on the teacher training. Oh, awesome.
Yeah, it was right next door in that next office.
Yeah, beautiful. And how is showing up as with vulnerability as a health practitioner, how has that changed your clinical approach? And I guess you've probably alluded to it a little bit with that story, but is there any other big changes that you've seen?
Yeah, definitely. I think a bunch of things, really. I certainly enjoy my practice a lot more because I have less of a burden of like I have less of a burden of like really having to get it right versus being really like open to pivoting. I think that the ability to pivot has really improved in my practice. I recently did a course, a tech course, and they talk a lot about how tech companies, you know, the way they work, and when you're building an app, is they build small parts and then they test them, and then if they either work or they don't work, and there's no blame or like no one gets in trouble if they don't work. They just go, okay, this didn't work, we have to pivot. And I think that's really how I've started to interact in my practice. Instead of having one clear answer, really like approaching it from, here's a creative, you know, solution, we're going to try it. And I'm really upfront with my clients about that too, especially if it's something that I don't fully like, I haven't seen, you know, it's not an injury I've seen 100 times, or if they're a complex case, you know, saying, I don't have a clear answer. This is what I think we're going to do. This is why I think it's going to work, but we're open to pivoting at any time if it's not working. So if it doesn't work, there's no one's wrong. It's just, that's not the right answer. I think that's a big difference. And for me, it's fun. Like that becomes more fun to be able to get creative and really like think through a problem. And that's carried really well for me as well. I've in the last couple of years have been working in people's homes, and that moving out of the clinic, you lose some of your tools, and you have to be really creative and come up with like different ways to solve a problem. And that's been like one of the things people often say to me when I go into their homes is like, that was so awesome that you were able to do it here, and like I didn't have to spend all this money on equipment or things like that. Yeah. And I think the other big thing is from like a happiness perspective, I'm much less hard on myself. And yeah, the work is more enjoyable. And if I don't know how to solve a problem, I'm much more open to like referring out.
Yeah. And is that, so that last point, is that because you're more vulnerable as a healthcare practitioner, or is that because you've done the work beforehand to get to that point, or both?
Both, I would say. You know, I think there's two cases. I think there's the case where I assess a client, and maybe from whatever it is, whether it's maybe maybe I know somebody who has more expertise in a particular area, or maybe and I just know that client's going to get better care if they go see another person, or maybe it's just like I can tell the fit is wrong, and I know that maybe there's somebody else who might do better with the client or connect better with the client. I mean, certainly I know when you and I worked together, there was times where we would shift clients between us and say,
Yeah.
I don't connect with this person, but I know Dezo will. And then that the client's happy, right? Because they get to have their problem solved with less pain. But then there's also the times where, yeah, you tried everything, there's an end to the creative process. And, maybe somebody needs to see somebody like a surgeon, or just a different practitioner, or, maybe it's even outside of the medical, community. Maybe it's actually a stress problem, or, maybe there's some mental barriers that maybe they need some support on that.
Yeah. I'm really interested here that in terms of I think that the challenges that you faced in regards to wanting to have the right answer, they're not unique to you. I think they're problems that come up quite often within the healthcare spheres, that like we want the right answer. We flick to the back of the textbook to look and see, okay, this is what I need to give to this person. How did you shift from that point to where you are at the moment in terms of being able to be vulnerable?
I think for me, it's probably been a lot more of the personal work I'm doing on my own. And, I was kind of thinking about it today, and I was thinking, so many of the courses that we do as clinicians are so like skills based, in terms of like, yeah, the textbook, or here's the manual on how to do this. And I think we really kind of missed the boat a little bit with our clinicians. Sorry, I'm not totally answering your question, but I'm going to get there. But I think we missed the boat a lot of times in terms of like just personal development within ourselves, and how, that's seen as other and outside of work. But I show up and I'm this professional, I put on my uniform and I'm this professional person. And there's not a lot of encouragement of those skills. Maybe we talk about communication skills, but I don't feel like we often talk about like, what are the barriers that are affecting your practice from a personal perspective. So for me, it's been, probably since I was in New Zealand, that's been this ongoing journey of learning about myself, and that's been through multiple different facets. That's been through yoga training, that's been through podcasts, that's been through reading, that's just been through going through my own states of having depression and having anxiety, and learning about myself, and that's really allowed me to become more compassionate, and realize that there's like also a lot of different ways that pain can present, and really starting to like understand clients as whole humans, instead of the shoulder problem, like that classic thing we we do sometimes as clinicians, like, here's Chris, he's a rotator cuff.
Yeah. So what I'm hearing from you is that there's no hack to it. There's no quick here's a 3-step process that you can follow as a cookie cutter and become vulnerable.
You know, I don't think that there's a 3-step perfect process, because I do think it in itself is like a learning journey. But I would say, in terms of if you're going to take like 3 points away to like start the process, for me, I think the first thing is just being open to starting the process, and really, the next thing is just being just really open to starting to observe yourself. So one of the ways I really started to notice it was anytime I felt aggravated with a client, or I felt frustrated, or like I wanted to rush them along, or like what I was doing wasn't working, that would be like an opportunity to just sort of step back and ask myself, like, okay, what am I feeling right now? Like, and you know, that answer might have been, I'm feeling like I don't know the answer, or I'm feeling, you know, inadequate, or I'm feeling frustrated, you know, and I think, and I think that what that does is it puts a label on that interaction, that then we can start to dig deeper and say, you know, why am I feeling this way? And what is it in me that maybe I need to like examine? And I think the more we start to start that process with ourselves, then we can then flip that on in the opposite direction. And when we see a client getting frustrated, or a client maybe being resistant, or a client maybe you know, even being angry, or you know, they're not doing their exercises, or they're not engaging, you know, instead of kind of getting frustrated with that, or being blocked, maybe starting to ask the question, like, what is going on with them? And even introducing that into our questions that we ask people, you know, are you afraid of something? You know, and I think we often stay away from that because we don't maybe want to know the answer, but it can be the thing that, you know, I think when we're vulnerable and asking maybe slightly vulnerable questions outside of the scope of just the injury, we open opportunities to connect with our clients and really actually get to the root of the problem.
Yeah, 100% agree with that. And I've kind of noticed, as I've started to understand myself better, I start to understand other people better as well. But also I start to maybe be a little bit more confident asking those vulnerable questions. I mean, I had someone come in and see me this morning who has been in pain for 6 months, and I said to them, I was like, look, pain's horrible, but pain often we can live with. It's the things that it stops us from doing that are often really challenging mentally and emotionally for us as a person, and that's often harder. And that just kind of created a way to go in and talk to her about that, and to focus the conversation around, okay, what's important to her as a person, and how is that going to be helpful for me in terms of us solving her problems and creating a health journey for her.
And that often, and that in that you build, like, you know, you build so much more trust in those moments with your client, that you don't necessarily build like just having the right answer, because having the right answer doesn't necessarily mean the problem is solved. Like, you still have to do the work, right? And you need that client's trust along the way. And I think in those situations, especially those people who their issues are complex, I think trust is, you know, if you show your vulnerability, you show that you get it, you get that whole picture. You know, in just building that trust, they're much more willing to go on that journey with you.
Yeah, and I mean, kind of extrapolating that out, what do you see in terms of changes for patient outcomes in terms of working this way and being a more vulnerable healthcare provider?
I definitely see, you know, I definitely see those, I definitely see those, that's okay. That, you know, I think the the so-called easy injuries that are probably the same outcomes, the ones that are, heart, quick and fast, and they, it's an ankle sprain and it goes along that same route, and whether you're vulnerable or not, like those ones are probably the same. I think the difference, and that's where you're looking at like the mechanic strategy of, like A plus B equals C, right? I think the difference I see now in terms of patient outcomes is much more with the complex cases, or the cases that are coming in and have had, have multiple facets to them. So things like maybe stress is related, or nutrition is related, or lifestyle, or mental changes. I'm seeing a lot more positive outcomes with them. Certainly, those are cases where I think there's the outcomes are good, but then the engagement, I think, compared to if I'm working on a less vulnerable strategy, that person may disengage sooner. Whereas working in a vulnerability type of strategy, you tend to see the client stick with you and really believe in the journey, even if it takes a long time.
Yeah, cool. And I mean, I completely agree that vulnerability it's something that's vitally important to us as health professionals. I mean, how do you think about balancing being vulnerable with kind of professional scope of practice and timeframes that you have to see this patient? Because at times it can be a more drawn out process.
Yeah, absolutely. I think two things. I think it's, first of all, changing our definition of what vulnerability means, and is that like it should be something that's built into our practice versus something extra that we maybe do on the side that costs us extra time. Like I think if we see it as a means to get to the goal either sooner or smoother, or like allowing our client to have a better outcome, then it really becomes a part of the patient experience. And it time wise, I've had this happen a couple of times where, especially on, I work on a much I'm able to do a bit more now because I see clients for longer because I'm at their homes. But in the 20-30 minute structure that is so often in private clinics, I had a couple of clients in the past where we just got into a really good conversation, and they got to address maybe a fear, or like a line of questions that they had, because I opened up the door for them that way. And we spent the whole session talking, and we didn't do any hands-on work, and we didn't do any exercises, but they left, and they, those are sometimes the most impactful sessions, because they leave feeling seen and heard, and that like we've talked through a plan, and they know where we're going, and they trust the partnership. And usually at those times, I say, what, like at the end of the session, I'll say, what, like I think that's all we'll do today, but I think it was, but then reinforcing the value of why that conversation is just as much therapy as the mobilization I might have done as well.
While you were talking there, I've just had this quote pop up in my head, and I unfortunately can't remember who said it. It might be one of those just kind of generic ones that's out there, but it's slow is smooth and smooth is fast. And I think that kind of slowing down and having those conversations allows the whole process to go a little bit more smoothly. And then if we're thinking long-term outcomes for someone, then actually if the process goes smoothly, those positive outcomes hopefully happen faster for them at the other end.
Mm-hmm. Yeah, exactly. And I think you also build the kind of knowledge as well in the client. So if it is something they're having to manage ongoing, I think you're able to better build those tools so that they might be able to manage more effectively independently on their own in the future.
Yeah, and Heather, if someone listening to this wants to walk away and put this into practice tomorrow, what's one thing that they could start with?
I think, yeah, like I said before, I think just starting with just observing yourself in moments of, so I'll use this more concrete strategy. So when I was going through depression, I had this little thing I did with myself where I assessed what my state of mind was when I was at neutral. So I wasn't particularly super happy. I wasn't sad. I wasn't upset. I was just like, I was chill. I was good. And then I started using this as a 10-point scale, and 10 in one, a plus 10 would be super happy, over elated, just like buzzing, and minus 10 would be sobbing, upset, really feeling down. And I started to observe myself in this strategy. So anytime anything kind of moved out of that neutral state, especially towards the negative, I would ask myself, what are you really feeling right now? And usually it wasn't, I'm not angry about this traffic, I'm really sad right now. So you can use this, I would say, this strategy from in relation to your clients in this way. Just starting to observe yourself throughout the day, watching your reactions for different things. And when you see a reaction that's outside of that, just that chill, listening, engaged state, when you start to feel frustrated, when you start to feel, like you're moving you're moving up that scale, may either make a mental note of it. Maybe you don't have time to examine it then, but maybe you will later in the day, and start to examine, what am I really feeling right now? And that gives you the opportunity then to break down, what's going on in me. And I think the more you start to do that, the more you start to find trends and maybe some things that you need to work on in yourself. And then, like I said, it also gives you the flip side of starting to see it in your patients.
Mm, awesome. I'm going to have to take that one away and work on it myself. Actually, that's a really beautiful strategy. Heather, if
sorry.
people want
I was
to, if
just going to
people,
say.
you go.
I was just going to say, kind of like we talk about posture with clients, like the more often you observe it, the more your brain tricks you, like the more your brain will naturally remind you when you're out of a bad posture, or you're in a bad posture, sorry. The same thing worked with this strategy. The more I started to ask the questions, the more my brain kind of noticed when I was out of that neutral state. And so it became easier and easier and easier to sort of pick up on those cues.
Cool. Yeah. And like
Mhm.
strength training, the more you do
Yes.
it, the easier it gets and the more automatic it becomes.
Mhm.
Heather, if people want to connect with you and have a chat with you more about this stuff, is there a way that they can do that?
Yeah, absolutely. I probably like LinkedIn or Instagram would be best. So I'm Heather Watson on LinkedIn, and Heather E. Watson on Instagram.
Awesome. And I will link that up in the notes for the show. Heather, thank you so much for joining me today. It's been awesome to have a conversation with you.
Yeah, it's been amazing. Thank you for having me.
And I just have a couple of questions for you right at the end, or one question for you for the community members.
Mhm.
Do you have a couple of questions that we should ask ourselves to push this area of practice a little bit more in ourselves? It's a really poorly worded way.
It's all good. I know what you're asking. I think one of the questions I would ask is, what barriers am I regularly hitting in my practice, and how do I like impact those? So you know, is it a true knowledge? Is it a true lack of knowledge? Or is there other factors that I bring to the table that maybe need work?
Yeah, and that's such a good question as well, because I mean, sometimes it is a lack of knowledge, but at a certain point, enough knowledge is good enough for it, and it's the other things that are slowing you down. Yeah, amazing.
I have a client who's a really successful real estate agent who gave me a strategy that I really like, and that kind of supports this idea. So he reads 2 books a month, and he reads 1 professional book. So he covers that skill set of whatever he feels like he needs impact to grow his practice. And then he reads one personal improvement book a month. So, you know, he tries to also identify, like, what am I missing from a personal, like, where are my barriers, or where am I getting stuck, and then taps into learning about that. So, I mean, I think that could also apply to things like, you know, podcasts, or, you know, there's so much information around everything. So, you know, if you're not a reader, you can also, you know, tap into listening to 2 podcasts a month, and seeing if you can build from there. And I also find sometimes the best way to learn what you don't know about yourself is start to listen to others talk about their journeys, and podcasts or audiobooks are great for that. Because a lot of times you don't know what you need to know yet until you hear somebody else talk about it and connect with those experiences.
Yeah, very true, very true. I'm going to stop the recording there.